Hey guys, Lindsay with Empower Movement Physical Therapy. So I wanted to talk about some of the exercises that we give people who come in here with jaw pain or TMJ, temporomandibular joint disorder. These are just general exercises. So if you feel like you've done these and they're just not helping, that's where we recommend coming in for a follow-up, either coming to see us because we're more the musculoskeletal specialists, and as I had mentioned in a previous video, our jaw is made up of all kinds of joints and muscles, so this is definitely something that we can treat. Unless it's a surgical situation, then you may want to talk to like an orthodontist or periodontist about that area. But I wanted to give you some general exercises that you can try on your own first before you come in to see us if you've been having some jaw pain as well as some headaches that might be coming from some tension that's in your jaw. So this set of exercises is called the Rocobato 6x6. So this progression was made up by this Rocobato dude who lives down in South America, and he's found that these exercises kind of cover the majority of the bases when it comes to jaw pain. So the idea behind this is that you are to do these 6 exercises for 6 repetitions 6 times a day. So the first exercise is just clucking your tongue to get your jaw in better alignment. So like, you know, that annoying like noise is what you actually want to do. That helps recenter your jaw and helps get your tongue more active with helping to keep your jaw in alignment as well. The next exercise is an opening exercise to work on your alignment. So you have that little ridge behind your front teeth, your hard palate. Like when you say the word mine, where your tongue ends up with the N of mine is behind the front teeth on that hard palate. So you want to put the tip of your tongue in that spot and then open your mouth. So the tongue's right there, and then it's not a very exciting exercise, but when your tongue is there, it doesn't allow your jaw to deviate in either direction. So it ends up having to go straight up and straight down. It's a great one to do in a mirror. The next one is called Rhythmic Stabilization. So you're going to resist moving your jaw side to side and opening and closing. So all you need is a finger or two. You're going to put it on the side of your jaw and then push your jaw into your hand, hold that, and then release it. Push your jaw into the side, hold, and release. You do 6 to one side, you do 6 to the other side, 6 with opening, and then 6 with closing. And then the next one is working on your upper neck. So oftentimes when the muscles of the jaw are tight, you also get a lot of tightness in the upper neck muscles, and you share a lot of nerves between your neck and your jaw muscles, and those nerves actually originate from the very top of your cervical spine and go into your jaw. So you want to open that up to allow as much nerve signaling and blood flow as possible. So for this exercise, you're going to put your hands right behind your head and just create a nice little collar, and then you're going to tip your head down. So I'm stabilizing my neck and just tipping my head down. You don't even have to go very far, and you'll feel a little stretch, these little muscles right here behind your head, and just open that up. Actually, that feels like really, really good. So 6 times a day, 6 repetitions of that one. The next one's a chin tuck. It's a very similar concept where you're opening this up and also teaching your upper neck to open up as well. So you're going to be pushing your head straight back. So what I like to tell my patients with this one is pretend someone ugly is coming in for a kiss and you don't want it. So you bring your head straight back. Then the last exercise is working on the shoulder blades. A lot of the muscles from here come all the way down and attach to the top of your shoulder blades. So the last exercise is just taking your shoulder blades and then squeezing them together. Hold it for a few seconds and relax it. When you're squeezing them together, make sure that you're not squeezing them upward like this. That's just going to tighten everything down. So squeeze downward and back. So again, guys, 6 repetitions of each, 6 times a day. If you notice that with these exercises, if they don't seem like they're helping a whole lot, that's when it's time to get a little bit more help and then talk to the professionals here at Empower Movement. Thanks.